attentive to what's happening there. I've met with civil rights groups around a number of ideas.
I am right.
About
She's not.
Okay.
She's.
Hi, Susan. Can she hear me?
Yeah, she's right there.
Yeah.
Let me see. Maybe.
It worked.
Good. Glad to hear it.
Yeah.
What'd you do? iPad do? Blow up?
Well, I've been having trouble with the battery, but it's 7 years old. And
Yeah.
I had called one of the computer guys and he said, nah, that just never works once they break that seal. And I just haven't gotten out to look and get another one.
Yeah.
But I'm going to shortly because I miss it.
You been vaccinated yet, Susan?
No, nobody's tried to. And that's one thing I want to talk about because we said, Merck Foose and I said that we could really do a big inoculation group at the pavilion, you know. So that's food for thought. I think she's already told Mayor Becker and all about it.
Right. The one we
'Cause
went
I
to,
said,
up in- you didn't even get out of your car.
Oh yeah? Yeah, but
Yeah.
Patty could get it because of being a first responder, right?
Yeah, I got it too, also.
Yeah.
There's Paul.
Oh, I thought you got it because you were really old.
That too, I guess.
Jim, how are you doing?
Good. I say I got my vaccination the other night.
Good.
You've had yours too, haven't you?
I have, yeah. I actually get my second dose on Monday or Tuesday.
Yeah. I don't get the second dose till the end of the month. Yeah.
Did you?
Dr. Marvel, did you? Go ahead.
What?
I was just going to say, did you have any reaction at all?
I had a sore arm for about 2 days.
Well, that's not bad.
No,
Jim, did you go to Dover to get it?
no, Smyrna. And they had it really set up nicely. You just stayed in your car. They
Good.
took your information, drove through, and they came up to the window and gave you a shot.
Oh, that's good.
Yeah.
They're doing the same thing at the DMV in Georgetown this evening.
Yeah.
I think they're at Georgetown tonight, and then Blades and maybe Frankfurt tomorrow night and Thursday night.
Yeah.
When do they start on the over 65 people?
The state hasn't given us an indication of that. So I don't know. Even as of yesterday, they still didn't know.
I did hear on the news, Dr. Cowan, that Carney is supposed to have an interview up on TV this afternoon about that.
Oh, good.
But I don't know what time. I didn't hear what time.
Yeah.
Anne Marie and I participated in a conference call with the governor earlier today. He didn't make any reference to it. He did talk about the Georgetown DMV thing. He said that there are 45,000 vaccines that have been received in the state so far. That's what was his comment today.
That's good.
The governor has his press conference every Tuesday at 1:45, so that's probably when he was going to talk about it.
Yeah, it'll be on the news tonight, I'm sure. Good afternoon, Dr. Tam.
Good afternoon.
Hi, David.
Hi, Paul. How are you, Dr. Cowan?
I'm good. How are you?
I'm good, thanks.
So it's, I have 3:00.
Yep.
Are we waiting for anyone?
Nope, Nancy's here. It looks like we're all here now. Okay. Good.
Just one point for when we do schedule our next meeting. Cheryl Hopple has a conflict this time every week. That's when the hospital emergency management folks meet. So if we can try to avoid that time.
Okay. Yeah, she mentioned that to me yesterday.
Right.
So, so there are minutes from the December meeting that we need to review and hopefully approve.
Everybody get a copy, I assume. So,
Okay. Can anybody make a motion?
move to approve.
Is there a second?
Second.
All right, there's a motion and a second. Any discussion? All right, all in favor?
Aye.
Opposed? I think the one thing that Zoom does still very poorly is the approval or the disapproval of minutes. That's still kind of awkward after all this time. So, yeah, so we're regarding Corona at the hospital, we're at the height of it. Well, I don't know if we're at the height of it or not, but we're certainly in the throes of it right now. So our the number of Corona cases in the state and hospitalizations continue to be trending upwards. And we're certainly concerned about the period in the middle part of the month. If you think about the holidays, and typically we've seen this sort of 14-day lag period between when people are exposed and develop symptoms and then get sicker and end up present for hospitalization. So it's going to be, it's going to be a challenge for the next several weeks or month or so. So David, do you have any more comments on that?
Yeah, thanks, Dr. Cowan. Certainly, we are reaching where we were back in the spring in terms of a number of COVID patients in the hospital. That said, there are less patients in the ICU and less patients on ventilators than was in the spring. That is a combination fact that we actually know better how to take care of patients. Back in the spring, as Dr. Cowan knows, almost everybody was put on a ventilator, while now we do a lot more work to make sure that we treat patients. And so ICU capacity is still reasonable as compared to where it was back in the spring. The other reason why I think that that we have less people on ventilators is because the number of patients who are older is less. We don't know what that comes from, other than simply the fact that I think that our older population certainly has gotten the message and are continuing to stay home, physically distant, wear their mask, wash their hands, and as a result, the population of patients are slightly younger and therefore less requirement per se for getting ventilation. So I think, it is a mixed message for us in the sense that we have more patients in the hospital back as a result of COVID, but that number in and of itself does not reflect our ability to take care of critically ill patients. And that's something we watch very closely every single day.
Good. As I think everyone was on, they're doing widespread testing not testing, but immunization, vaccinations for first responders in the county, beginning this evening for the next 3 nights. There'll be a motor vehicle in Dover or in Georgetown tonight. So that'll be exciting, and hopefully we can get into the 1B, which is where I think we can really make a dent in the community. So.
Who is organizing that, and how is it being announced? How did people find out?
So for people in the 1B category?
No, in the 1A category.
So for first responders?
For example, how did Dr. Marble know to go to Smyrna?
Yeah, so that's a good question. So it occurred a conversation between the Fire Prevention Commission, which is the regulatory oversight body for the fire companies, and the Department of Public Health. So each fire company was given a number of, after kind of querying about how many of their members were interested, active members that needed the vaccine, they were given a number. So for instance, when Lewis was given a number of both vouchers, which were to use for their volunteers, and then actual immunization slips for their career people. So it's the kind of nuances of it, but it's occurred over the last 2 weeks. The first vaccination sites were in Kent County last week, and they kind of did that really more from a logistics standpoint because all of the vaccine is coming out of Dover at this point. And then they are, as I said, they're going to occur in Sussex tonight and the next 3 nights, and I assume in Newcastle at the same period of time. So that's kind of a long answer, but essentially came through the communication between the Fire Prevention Commission, fire companies, and then Department of Public Health.
And what about your people in the hospital? Are they all done?
So at this point, we have offered or are still kind of in the back end of offering the first round of vaccine to all of our team members and our affiliate physicians. So I understand we have offered it to everyone, and they're kind of the tail end of those people are being scheduled now. We'll actually pivot into the second round of immunization beginning at the end of this week. So I think Friday is the first time we'll do that, and then beginning next week we'll be doing. And then we'll go back and we'll offer anyone who has initially declined a vaccination, whether they want it for the second round. So we're kind of moving through. Dave, do you have any other comments on that?
Yeah, Nancy, that's a great question because, as you know, our allocation was for our physicians. We were asked how many doses we need, and for the hospital. So that's all the people who work here, frontline workers, as well as the physicians who are on our medical staff. So there are people who are doctors who are not on our medical staff who are working to get their vaccination doses through the Medical Society of Delaware. That said, we have gone through and invited everybody to get the vaccine. The law is such that we don't have it, it's not a mandatory vaccination because it is still under emergency use authorization. That said, we are encouraging everybody to get it. We're about 2/3 of the way in terms of people who are vaccinated, with probably another 800 some people getting their first dose by the end of this week. And as Dr. Cowan says, we're now cycling to start the second dose for the Pfizer vaccine for our staff. At the same time, now that there's more vaccines starting to come out, as you may have heard, we are rapidly developing a plan on how to vaccinate other Tier 1A personnel or people. Dentists, for example, the dental group are technically Tier 1A. The Parcells at the funeral home are Tier 1A. We do not have the vaccine for them because we only ask for the vaccine for our health system. But we are recognizing, though, that the Parcells, for example, don't necessarily have the ability to give vaccine themselves, or the dentist, unless you give it in your mouth, which obviously we don't do. And so clearly that's our next step as we get to the point where we're starting to make sure that all of us are vaccinated, is then vaccinating everybody else on Tier 1A and giving them that opportunity, because after that comes Tier 1B.
And are you planning for Tier 1B already?
So we are developing the plan of Tier 1B, but what we are working on is how we use our clinics at BB Medical Group, right? Because those are the people that we manage to distribute the vaccine to the patients. Physicians and private practice in other private practice, not in the BB Medical Group or under the BB healthcare system, are working independently on how to allocate or get allocations for their patients through the state to get their vaccine. And so I can't answer the question yet on how the other practices that are not under BB healthcare are planning to get their vaccine. And we're also, by the way, working with those other practices to see if they want us to do it for them, for their patients, but that's still something that we are working on developing the plan for.
Hey, Marie, did I see another question just popped up?
Yeah, so we have 2 questions. How does the general population find out where and when vaccinations are available? And what will you do if one of your patient-facing staff decline to be vaccinated?
So I guess the first question with regards to where you can find out about the vaccination is still kind of to be determined. It sort of depends on, that's why the conversation we had just before about the governor, we're kind of waiting for direction from DPH. So the toughest question is, and I've had this with Ted a couple weeks ago, is what do we do for people that qualify for the vaccine that either don't have a healthcare provider in the state or don't have a healthcare provider at all? How do we make sure they don't fall through the cracks? So those are the things that that DPH is kind of working through now. We're kind of waiting for guidance as a healthcare system. David, I'll take the first crack at what do we do if we have an employee who won't take the vaccine. You know, at the end of the day, it's a personal healthcare health choice. We can give people all of the information, and they certainly kind of make their own decision. When we've had people in the past that have not taken the flu vaccine, and we still have some people that do that work here, you know, they have to take extra precautions so they don't transmit that, you know, wearing a mask all the time, which we're doing as it is now. So, but there are no plans, and correct me if I'm wrong, David, to make the vaccine mandatory for our team members.
So just to follow on with what Dr. Cowan said, number one, with respect to getting information out to the general public about when they are eligible or when it's time for them to get their vaccine, BB Healthcare is developing a distribution plan for the patients who have BB Medical Group doctors, only because that's how we control the communication to those people about how we will do that, how we'll distribute that, you know, emails, as well as our Facebook live town halls and other ways to say, now it's time to, for those of you who are in 1B or something like that, to call us and schedule an appointment to get your vaccine. We do not envision at this point, you know, like what's going on in other states where there's lines going around, you know, the stadium to get your vaccine because at the end of the day, that's just not a good thing to do. I mean, it causes more physical gathering. With respect to the second question, as Dr. Cowan says, from a health patient perspective, as well as from a human resource perspective, you know, this is a vaccine that people still have the right to decide whether or not to take the vaccine. I think a lot of people are doing that, but I want to be very clear about one thing. The purpose of the vaccine when you get it is to make sure that once the virus is in your nose or your throat, right, it prevents you from getting sick. It does not prevent you from having that virus in your nose or your throat. So there are still studies that are out there still going on about whether or not getting the vaccine reduces your quote unquote infectivity, your ability to infect others, right? And so it's really important. That's why we are still saying to everybody that even if you get the vaccine, you still have to wash your hands, wear your mask, and watch your distance. Because until those studies come out, all we know is that the vaccine is really effective about making sure that you don't get physically sick from having exposed to the virus in your nose or your throat. And so our staff, regardless of whether or not they are vaccinated or not, will continue to be using all the PPE, to wear their mask, watch their distance, right? And to wash hands so that we do not do anything to potentially infect others, patients or other staff. And so that's the way we make sure that we are providing a safe environment for patients and other staff who come to BB Healthcare. It's not necessarily about whether or not the vaccine will reduce your ability to infect other people.
Just one other thing I want to mention, as the mayor said, we were on a call with the governor this morning, and it sounds like they definitely are working to develop their plans for the 1B distribution. They did mention the Medical Reserve Corps, which is volunteers, and that there are people in each county. And I know Mert Foos has been involved in the the Medical Reserve Corps. She has also indicated that if we want to have some sort of a community vaccination event, we could use the American Legion pavilion. So that information has been shared with the state. And, we're very much going to do what we can at the community level to facilitate the state getting the vaccine distributed here in the Lewis area.
That's great.
Dr. Rattay also mentioned on that call this morning that there was a question raised about people who are here who have been sheltering here in their second homes as opposed to being back in Maryland or Pennsylvania. And she was suggesting that we should plan to take care of those people as well as part of the procedure, as part of the anticipated need for people to get vaccinated here. So sounds like we could end up with a much larger population than we initially might originally think would be the case.
Well, Mr. Mayor, if I could just add on to that, that's why what BB Healthcare is doing is, one, making sure that we have the capacity and the resources to take care of patients who come to our hospital and our clinics, right? Because we know who they are, we know how to communicate with them, but also B, ensure that we work with the state to do some of the things for the community, like those drive-up events. Remember
Right.
when we did all the drive-up testing events? Because we would test people in the clinics. We tested people, at our clinics, but we do need to get past, of course, the people who don't have a doctor to be able to identify themselves and to come and get the vaccine. And so, I spoke to the governor last night, and I think he's going to rely to some extent on the Reserve Corps, National Guard, and of course, the individual health systems to partner together on those people who, like you said, don't have a primary care physician in the area.
Right. Great. See, we have another question regarding the African American community's apprehension to get the vaccine. Paul, do you want to address that? And how we're
It's I have done a couple Zoom meetings since this last meeting with a couple different groups of first responders, kind of going over the data, if you will. I certainly understand I understand why people are reluctant to get the vaccine. It's a healthcare choice. I get it. I understand that the African American community is even a little more sensitive to it. But at the end of the day, I think that as every day goes by, one of the other things that I add to my comments is that, listen, there are a lot of us now that personally that have gotten the vaccine that have not had an issue. And now we're going out, days into weeks, and we're getting to the second immunization of the Pfizer vaccine will be the second immunization period of the Moderna in 2 weeks. So now there are literally a few more million people in this country that have gotten it and done well with it. It's probably even a little more important for our communities of color because they seem to be hit by the virus harder. So if there's a specific group that it's really important to consider the vaccine, that's it. And I'm available to talk to anyone or any group in our community that has questions about it. And I think that sort of helps. At least I hope that it helps. But I certainly, whoever asked that question, Ted, if you could
Sure.
make myself available to him.
Okay. I think probably going through some of the church groups might be a very effective way to reach them, and we'll certainly reach out to those
Sure.
members of the clergy that are serving that population and make
Sure.
sure they're aware. Thank you very much.
Yep.
And I do want to say that I was fortunate to be able to participate in one of the sessions where Dr. Cowan talked about the vaccine. And I don't know, honestly, I don't know if it changed anybody's mind. I haven't gone back to reassess, but I can tell you that the way, Dr. Cowan, the way that you talk about it is very calm and factual. And I think that's something that, unfortunately, in today's, echo chamber type world, we don't get. So I think, if that would help people and you're willing to do it. I just found the way you talked about it to be very reassuring.
Good, thank you.
Without pushing people to do it, just laying out the facts so that they can make their own choice.
Right. At the end of the day, this is a personal health choice, and I get it. So I think you just need to give people the facts and maybe dispel a few rumors that are circulating, and then kind of allow people to make their own decision.
The person who asked the question about the African American community also went on to ask another question about, are you keeping data on ethnic groups getting vaccinated?
Well, so at this point, the only people we're vaccinating are our team members,
yeah,
and the first responders. So, and it would be difficult, I think, early on in 1B to gather that data. It's like so many things in this pandemic, it'll become crystal clear in 18 months. I think the opportunity to make sure we don't miss at-risk groups are through like local groups, like churches and stuff. If they realize their population or their church is absolutely not going to do it, we know that's an area that is at risk. But it'll be a while before we actually have demographic data on the vaccination.
Sure. Oh, will the person gets vaccinated if they're participating in the DIN? Will that vaccination be noted in the DIN record?
It should be, although I suppose to some degree it depends on the venue in which they're vaccinated.
Exactly, I would think.
If they're vaccinated in their doctor's office, absolutely. I don't know if the Department of Public Health has had the conversation. I know they, in some ways, have visions of some of the larger pharmaceutical chains, participating.
Mm-hmm.
So I don't know what their plan is for uploading that information, but you sort of have to have it. And, there's a reasonable chance that you're going to have to demonstrate your vaccination status at some time in the future if you want to do certain things.
That was on NPR this morning about getting on an airplane. You're going to have to demonstrate that you've been vaccinated, or maybe going to a large concert or something.
Sure.
Large venue events, yeah.
So that will be that'll be really important, that information. Certainly everybody has a card. I think everybody that's on social media has seen everybody with their little CDC card. It did strike me when they handed me my card that it was actually not a piece of paper but a card. And my first thought was, well, this is important. I better keep it somewhere safe. So I don't know if I'll be showing people my vaccination card for the next 18 months or not. So
Will it be going in the yellow books?
I'm not sure what you mean by yellow books.
What you take overseas for your vaccination records?
Oh, I see. Yeah, absolutely.
Should go there.
Yeah.
Mr. Mayor, can you talk a little bit about your sense of the governor's planning? I mean, we've known this vaccine was coming. Why don't we have a plan already that was ready to roll out? Is there a sense of urgency about this?
I think there's distinctly a sense of urgency. I think that availability of vaccines and when it's coming has been one of the issues, and how much they're going to have, and getting to the various groups like first responders and then getting to 1B have been some of the stumbling blocks. I do think that the governor certainly conveyed a sense of urgency this morning in the conversation, but they're anticipating trying to do larger numbers, and that's why I think they're asking for the various medical corps groups and even retired people. And he mentioned even veterinarians possibly stepping up and volunteering who might be available to do vaccinations this morning in the conference call. So I think there is a sense of urgency, but availability of vaccines has been a real issue, and knowing when you're going to have them.
That's a separate issue, but having the plan in place so that the minute the vaccine hits, it's ready to go. It goes in an arm.
They have a plan.
Yeah.
The COVID-19 vaccination playbook is on the
It's on the governor's side.
on the state website, and that came out in October. So they have a plan. It's just kind of putting that plan into action. And I think, like the mayor said, it depends on the availability of the vaccine, because my understanding is that there are more people in that 1A group than we have available vaccine at the moment. So I think that they know who's in what group, and they're starting to make the plans, but until they know how much vaccine they're going to have and when they're going to have it, they can't make the very finite plans.
And I think there has to be a steady stream of vaccines available so that they can give the second dose in a timely way. Because you're already hearing on national television where people are talking about stringing it out a little longer because they're not getting enough to do it. So I think that there's a real issue in the supply chain.
I spoke with a friend in New Jersey this morning. There's a statewide registration, particularly for the people in the 1C group. Is something like that planned for Delaware?
I'm not aware of one, Nancy, but we can certainly ask, okay?
They were complaining about the quality of the website, but there was at least a registration so that the state would have an idea of what the population is and where they're at, what their phone number is, et cetera.
Mm-hmm.
In Florida, they're already vaccinating people. Texas, they're already vaccinating the over 65 crowd.
Mm-hmm.
I'm seeing a few more questions, but I can't see them in their entirety.
One is, having read the plan, it does not appear to be who or how the vaccines are going to be given, and the details need to be worked out now. That was one comment that was made. And then the other one is, it appears as though you may be able to register as a vaccine provider in Delaware. I think that is, that's from Mert Foos, who, as we all know, has been very active. And so I think we plugged her, Anne-Marie put her in contact with Carol Rattay this morning, and I think Mert's already followed up and is probably registering herself and some of her colleagues to get into this situation and be able to help. So I think the call has come out, and it's happening.
Good. There's just two other quick topics that have sort of come up and I wanted to address if they're a question for anyone. First is the question, there's some talk in the UK about not timing their second dose as directed by the manufacturer. There's been no meaningful talk about that in this country. As a matter of fact, the FDA has said that it's not recommended by the manufacturers. They're not considering it. And that's just the AstraZeneca vaccine. There certainly was no data at all that I'm aware of between the Moderna and the Pfizer vaccine about the efficacy of a single dose. And recall that the AstraZeneca vaccine is a very different, it's a more traditional vaccine. So there's no suggestion that that's going to happen in this country at this point, fortunately, which I think it makes sense. It's hard enough to convince people that what the appropriate medical literature says about the vaccine, but then to try and convince them to use it in a way in which has not been studied just seems not responsible to me at all. So fortunately, that's not an issue in this country for us. And the second issue that the mayor just made me aware of just an hour ago, I appreciate it, is a third-party vendor called Curative, who provides pop-up COVID testing. Actually here in Delaware, actually here in Lewis this week, I think I saw something on a website that they'll be at the firehouse on the 7th. There was an advisory statement from the FDA yesterday that cautioned people about a false negative test, and it largely appears to surround the inappropriate collection of a specimen, which is, it's not hard to believe if any of you have had COVID testing, or really good COVID testing is quite frankly a little uncomfortable. So I don't really know kind of where that's going to, if that will change I assume we'll still have the testing here in the state. I hope that because of this information, they'll be a little more fastidious in the way in which they're doing their testing. It does bring up a bigger issue, which I think the general public sort of misses. And there is in a setting of you being exposed to someone, there's sort of a belief that, which I kind of understand, but it's not based in medical fact, that if you have a negative test, you're fine and that's okay. You sort of miss the bullet and you go along with your life. And again, that's not the recommendation from the CDC. The CDC has currently 2 recommendations, one of which is if you're exposed to someone, you have what's considered a high-risk exposure, which is being close to somebody without a mask. They recommend that you have 10 days of quarantine. Alternatively, you can have 7 days of quarantine if you get a test after 5 days. And it's assuming you have no symptoms in that period of time. So the 5-day portion of that 7-day period was chosen because we know that most people develop some sort of symptoms within 5 days. So if you're honest with yourself and you've got some symptoms, then you don't qualify for quarantine. You need to quarantine until you're tested. But I think that the fact that people think if they get a negative test, they don't have COVID. I think that's the break there that would be helpful from an education standpoint. Dave, do you have any comments about that? You're on mute.
No, I don't. I think you covered it very succinctly in terms of to continue. And I think the only editorial comment I'd make for Dr. Cowan is simply the fact that every day we are learning more information, because this is all stuff, even the curative tests are all emergency use authorization. And, it's safe, it's effective, but we're learning more and more every single day about, some of the details around everything. And I think that's one of the reasons why it's important to continue to have these public venues to talk about it.
Great. The governor made mention this morning about antibody infusions that are going on. And are you doing that at BB? I assume you are. The governor was very complimentary of BB's rolling out the vaccine and made mention of you at the hospital directly and to the entire group that was on the call today. So congratulations.
Thank you. So BB does offer what's called monoclonal antibody therapy. But there are specific criteria for it. Essentially, you have to be in what's considered a high-risk group. So you need to be over 65 or over 55 with significant comorbid diseases before you qualify for it. And it's interesting, it is the monoclonal antibodies are indicated for people that are currently not hospitalized, who are at high risk to become hospitalized. But they are not shown to be effective for people that are hospitalized, which is kind of interesting. So it is, in the words of Bill Chasnoff, our infectious disease doctor, he described it as another tool in the toolbox, but not a significant tool, which is a good way to look at it.
I do know somebody who had a very good outcome as a result of it.
Good.
And is back functioning in a normal capacity. So, and they actually got it at BB. So thank you.
Absolutely.
Can I ask what's happening at the school and out at Moorings, just for an update of those 2 locations?
I don't have any information on that.
Governor made mention this morning that he was encouraging schools to go back to the hybrid model starting next week. But beyond that, he didn't offer anything else this morning in his conference call.
I continue to ask if the superintendent cannot be encouraged to reach out to the community beyond the school, that it impacts all of us what happens at the school.
Right. Yeah. He was very good. Again, he singled out Cape Penelope School District as one of the school districts that's done the better job in the statewide. So.
Well, and since the school has been closed down, they just opened back up.
But he was referring overall, not just right now. Yeah. So.
It's just that it's very hard if you're not a parent or involved in some way in the school to know what the situation is.
Right.
You can get it sort of 2 weeks later, you get a statistic on the website, but that really doesn't help when you're trying to decide whether to go to the grocery store or not.
Mm-hmm. The email that came out from the governor's office today, the press release about encouraging schools to go back to the hybrid model on the 11th, Dr. Rattay mentions in the press release that the cases that they've had in schools based on the epidemiology that they've done have not originated at schools. They've originated through other contacts, and that there's been very few cases where there's been transmission in the schools, and in those cases, the mask requirements were not being followed.
They're kids. I mean,
Actually, I found some kids were better than some adults.
So Nancy, this is just David as a parent and not as a president and CEO of BB Healthcare. But you're absolutely right, Ted, Mr. Mayor. I mean, football players wearing masks while running, it just boggles the mind that they are doing that because the coaches say, if you don't do it, I'm kicking you off the field. And so it's remarkable what kids will do to try and get back to some semblance of normalcy. I think.
and my point is that if the rest of the public knew that that's what was doing, if he reached out and let us know that, we'd have a greater confidence about it. But in the absence of any information, you sort of go back to your stereotypes of what you see when school dismisses and half of the kids don't have their masks on when they leave the campus.
Yeah.
Ted, can we invite the superintendent to our next meeting?
Certainly can invite Bob. Yeah, Bob Fulton to come. Absolutely, be happy to.
Sure.
And he hasn't in the past been willing to do
He's
that.
declined in the past, yes, but we can certainly re-extend the invitation.
Okay.
Okay. Any other questions? I don't see any new questions or new comments in the chat. Do you, Anne Marie?
No, but I did see, I just went to the DHSS Facebook. They just, while we've been meeting, have released the numbers from yesterday. So they're actually worse. So yesterday there were 10 deaths, 771 new positive cases, 43 new hospital admissions. But again, you guys have a better handle on the hospital in this area. 431 hospitalizations total and 56 critical. So the 7-day average percent positive is 26.6% of persons tested and 10% of tests. So that's higher than it's been. So I think we're starting to see that post-Christmas spike.
Mm-hmm.
Yeah, I think the next couple weeks are going to be really telling. I wouldn't in any way suggest that in a couple weeks we'll be through this, but I think that we're going to see what the holidays were like actually before we meet again. We'll have a good sense of it, unfortunately.
I think you're right. Okay. All right. I think we have any other questions. So I think this has been a very helpful discussion. And we will reach out to the churches and see if there's information or desire for you all to get in contact with them or set up some information.
Sure.
And we'll certainly reach out to Superintendent Fulton and invite him to come to the next meeting.
Okay.
Okay.
Mr. Mayor?
Yes, sir.
Just to let you know, though, that we're working on the vaccination plan as fast as we can. And so we will have a video town hall on Facebook Live this coming Friday, where Dr. Chazanov will share the latest information on what we're planning and how people can, what people can expect, as well as more information about the vaccine itself. We've done information on Facebook Live in Spanish, and we've done it on Telemundo. We had Dr. Arias, as Dr. Cowan knows, who's our ICU director, who's also spoken, to the Hispanic community. So it's this Friday. It'll be on Facebook Live. I don't have a time. That's what I was looking at. But please make sure that people reach out so that we can share the information that's as up to date as possible.
Mr. Mayor, perhaps we could also encourage someone to represent the non-BB doctors and medical professionals who can talk to the community that they serve and how they will be organized, because not everybody belongs to the BB network.
Sure.
I'm shocked, Nancy. but I understand I understand exactly what you're saying. We want to make sure that everybody's covered, but you're absolutely right. And if that happens, Mr. Mayor, please let me know how I can work with the community physicians to make sure that the community is taken care of.
Will
God
do.
bless.
Thank you. Okay, if there's no
I
further,
do have one question,
yes,
and
Susan.
I think this question will be for Dr. Tam and Dr. Cowan. Mert Foos and I had talked about giving the inoculations at the pavilion. Now, are we going to have a physician on site if you do that in case someone has a reaction?
No.
No.
No. The incidence of anaphylaxis is really low. And the more we do, the more we understand that. At the current sites, they have had paramedics standby, but to my knowledge, they haven't been used at all. So I don't know. So you certainly will not need a physician. The question is, I don't know if, depending on how many sites we have, how active they are, if it's, for instance, if it's like at the American Legion, if that happens, if Sussex County is able to provide a paramedic unit for it, I'm not sure. It depends on how big it is, i.e. how many immunizations they plan to provide. But you do not need a medical director or a physician on site.
And
It's a very large building, so that you could really, you've seen it, haven't you, Dr. Tam? Yeah.
yes, ma'am, I have. And
What
Susan,
about the parking?
I think
Yeah.
the questions are going to be, like you said, about the logistics, Susan, more than it is about the provider or the practitioner, because it does require documentation, paperwork, getting it into the system. Because what we also want, as I think Mr. Mayor, as Ted said, is once you get the vaccine, it's just not the card. It has to go into the Delvax information system so that there is documentation in the computer that says that you've had this vaccine and it's Pfizer lot number X, right? Or Moderna lot number Y. And so, this is one where I'm sure happy to help if Mert or you want to call, and we need to figure out how to support what you're trying to do in all those other areas rather than simply having a physician or somebody available in case of a medical emergency.
Okay.
Okay?
Terrific.
Can I ask one more question? I'm sorry. This is, you had mentioned, I think in about England or somewhere else where they're using the AstraZeneca vaccine. Are we close to having that as one of the available vaccines here? And I know there are a number that are kind of, last I heard, nearing the finish line in terms of authorization. Is that still likely that there will be more?
So yes, it's likely there's going to be more vaccines available. AstraZeneca was the first traditional vaccine to come online. To my knowledge, AstraZeneca has not submitted an application to the FDA for approval. Once that happens, that would take a few weeks for it to happen. I don't know why that hasn't happened, but I haven't even heard much about it potentially going to happen. Johnson & Johnson is another company that has a vaccine that is in phase 3 trials now. The last time I read anything about that, they thought they may not have something for approval until the middle of February. So still a ways away. So I think at this point, what makes sense for the boots on the ground is to make our plans based on the availability of both Pfizer and Moderna. So.
Okay.
All right.
Okay. Looking at, if we're going to stay on our 3-week schedule, it looks like we're looking at the week of the 25th. We don't want to do the 3 o'clock time frame. So I think Dr. Tam and Dr. Cowan, your schedules are probably tighter than anybody else's. So if you could kind of indicate what good time for you, we'll try to work with that.
I'm available, David, earlier on the day of Tuesday and on the 27th, and almost on the 26th, and all day on the 27th. Those of you that don't know Lynn Wilkins, that was her voice in the background.
That was the sergeant major over there.
I mean, your other brain.
No, not my other brain, just my brain.
Okay.
So did you say the 26th, Monday or Tuesday?
Tuesday.
Tuesday earlier in the day or anytime on Wednesday.
Tuesday, I can do 1 o'clock.
1 or 1:30.
Or 1:30.
How about 1 o'clock?
1 o'clock is okay?
Yes, sir.
She says okay.
Okay, great. So
What's that
Tuesday,
on
the 26th at 1 o'clock.
Okay, and just, I don't think it'll conflict because we're still under 45 minutes, but the governor has his press conference at 1:45 on
Right.
Tuesday, so.
Okay, great.
Okay,
All right.
Well, he can
Thank you
join
Thank you very
us.
much.
good. All right, thank you.
Thank
Bye.
you.
Thank you very much. We'll be in touch about some of these contacts, okay?
Okay, all right, good, thanks.
Thank you. Okay.
Yeah.
Bye now.
Bye.
Bye.